Your liver is about the size of a football. It sits just under your right rib cage, and it performs over 500 functions every single day, filtering toxins, producing bile, regulating blood sugar, metabolizing every drug you take. And right now, roughly 1 in 3 American adults has significant fat deposits building up inside it. Most have no idea. This is non-alcoholic fatty liver disease, NAFLD. You don't have to drink alcohol to get it. In fact, most people who develop it barely drink at all. The driver isn't alcohol, it's sugar, specifically fructose. Here's what's happening. When you eat fructose, found in table sugar, high fructose corn syrup, fruit juice, and sweetened beverages, your liver is the only organ that can process it in significant quantities. Unlike glucose, which gets distributed to cells throughout your body, fructose goes almost entirely to the liver. When the liver gets more fructose than it can handle, it converts the excess into fat and stores it directly in liver tissue. Over years, this fat accumulates. The liver gets inflamed. The inflammation causes scarring, called fibrosis. Advanced scarring is cirrhosis. Cirrhosis is permanent. The terrifying part, NAFLD causes almost no symptoms until it's advanced. Some people notice fatigue and a vague discomfort in the upper right abdomen. Some develop a condition called metabolic syndrome. High triglycerides, high blood pressure, insulin resistance, and abdominal obesity together. These are warning signs. But most people have none of that. They feel fine until they don't. So how does the liver actually heal itself? Your liver has remarkable regenerative capacity, but only if you stop fueling the damage. Step 1. Cut liquid fructose. Sodas, fruit juices, sports drinks, energy drinks. These are the primary drivers. Whole fruit is fine because the fiber slows fructose absorption significantly, but liquid fructose hits the liver fast and hard. Step 2. Increase dietary choline. Choline is a nutrient found in eggs, beef liver, salmon, and cruciferous vegetables. It's essential for packaging fat out of liver cells. Choline deficiency is one of the most consistent findings in NAFLD patients. Most Americans are significantly deficient. Step 3. Address insulin resistance. NAFLD and insulin resistance are deeply linked. Each makes the other worse. Reducing refined carbohydrates, increasing protein, and adding resistance training directly improves both. Step 4. Get checked. A liver enzyme panel, ALT and AST, is part of a standard blood test. Elevated levels are often the first lab sign of liver inflammation. An ultrasound can detect fat accumulation. If you haven't had either in the last few years, ask your doctor. The liver can heal, but only if you give it the conditions to do so. Talk to your doctor about your liver health, especially if you have metabolic syndrome, diabetes, or a family history of liver disease. Subscribe for more evidence-based health breakdowns every week.